Now, following California's push to create a single-payer healthcare system, New Hampshire, or at least one representative in New Hampshire, is deciding, hey, you know what? Now is the time for single-payer. Now, this was sponsored by Representative Peter Schmidt, a Democrat from Dover, and the bill is called Establishing a New Hampshire Single-Payer Healthcare System, and it will soon be introduced. Now, Schmidt follows Senator Jeanne Shaheen, who now has endorsed Bernie Sanders' bill to set up a national single-payer healthcare system. She is also from New Hampshire. So, among the Democratic Party, support for single-payer continues to grow. But despite a national support for the national single-payer system growing, Schmidt says, you know what? We're not going to wait for the federal government to do that. We're actually going to try in New Hampshire on our own. He said the healthcare situation is very much in flux nationally and here in New Hampshire. And the bottom line is it's just utterly irresponsible for the New Hampshire legislature not to engage in this situation. Now, this is a lot like what California is going through as well, with many legislators now looking into creating their own single-payer healthcare system. Now, this isn't the first time that New Hampshire actually looked into doing this. They floated this idea before. In 2011, the state legislature passed a bill authorizing the creation of a single-payer healthcare system, giving then-Governor Peter Shumlin a mandate to devise a plan by the year of 2013. Now, obviously, that didn't pan out. By 2014, Shumlin, a supposed longtime champion of the effort, backed away over concerns over the cost. Now, that plan, according to the Concord Monitor, would have required a 9.5% increase in state income taxes, an 11.5% hike to the payroll tax. And one analysis estimated a $4.3 billion annual price tag with an annual budget of about $4.6 billion. So look, it is pricey. Of course, you're doing a healthcare system that is superior in every way to our health insurance system. You're going to cover everybody. So yes, it'll cost, it will have a cost attached to it. Now, is the cost more than what people are paying? I think there's a lot of studies that do not take that into account. Because right now, already New Hampshire spends a lot on healthcare. According to the Kaiser Family Foundation, healthcare spending per capita in New Hampshire in the year of 2014 was about $9,589. So that is fairly pricey per capita. And this, of course, is both private and public spending on healthcare. Now, imagine how much more efficient it would be if you consolidated healthcare into one plan. It would cut down on advertising fees. Well, you wouldn't have any advertising fees. You wouldn't have as much administration, and hospitals would end up saving money because they wouldn't have to hire so many people to do multiple insurance claims. It would be very, very simple. So again, that's private and public spending, and they don't really take into account the savings that will happen under a single-payer system. Numerous studies have shown that there will be a lot of savings under single-payer. For example, right now there hasn't been a study for New Hampshire. Now, there are other Democrats in the New Hampshire legislature that actually want to do that study. But there are other states that have done their own studies, and here's what they found. Back in 2003, Missouri Foundation for Health conducted a study on healthcare expenditures and insurance in Missouri. They found that a single-payer healthcare plan in the state of Missouri would reduce overall spending by about $3 billion. Assuming, they said, the universal healthcare plan adopted a benefit package typically found in the state, spending among the uninsured and underinsured would rise by nearly $1.3 billion when fully implemented. On the other hand, the use of a streamlined single claims and billing form would reduce overall spending by about $3 billion. As a result, healthcare spending would decline by approximately $1.7 billion. A fiscal study by the Virginia-based Lieu Group found that single-payer healthcare would also cover all Georgia residents and save about $716 million annually. The Kansas Health Policy Authority hired the consulting firm of Schramm Raleigh to do a fiscal analysis of the 5 options for expanding coverage. They found that single-payer, what they called the Mountain Plan, would cover all the uninsured and reduce state health spending by $869 million annually. On and on. There's a lot of different studies. I'll actually put those in the link in the description of this video. So on that, overall, covering everybody under a streamlined system of just government insurance through the state saves money. Nearly $1 billion in a lot of these different cases. That seems like a no-brainer, right? But the problem is, well, whenever somebody goes to say that, yeah, but what we're going to have to do to pay for it is we're going to have to raise taxes. That's where everybody freaks out. Oh my God, no, the taxes is too much. It's too much. We can't raise taxes. We definitely can't raise payroll taxes. We can't raise anybody's taxes. No. We got to back away from single payer. We got to back away. Now, here's the thing, right? They're scared because taxes right now in American culture people hate taxes. It's ingrained in us to despise being taxed, even if it goes to things that are very, very beneficial to us and will actually save us money in the long run. Healthcare is one of those things. It's been shown that right now, take Canada, right? They spend twice as much that we do per capita. I'm sorry, we spend twice as much as Canada does per capita on healthcare. They spend half as much. Now, they don't pay for any procedures out of pocket, but they get taxed higher than Americans. Americans look at that and go, I don't want to pay taxes. I would actually rather pay more in health insurance premiums to a for-profit corporation because I hate taxes. That doesn't make any sense. But nobody tends to make that case. All the cases, and especially when you're a politician, you go, well, my constituents, they hate taxes. If I even think about raising their taxes, they're going to vote me out of office. That's why single payer has failed in places like Vermont and Colorado, because they couldn't get people to actually face that, hey, we are going to raise taxes, but overall, you're actually going to save money. Now, me, I actually know the reality, and I know that I will save money under a single payer system, even if my taxes will end up going up. And I actually don't mind paying taxes as long as I know that it's actually being used for positive things. For example, if I know that this tax money is going to go to me getting health care and my family getting health care and my friends and everybody getting health care, that's good. I like that. There's a lot of people who disagree and like, no, only I deserve health care and nobody else, and I don't want my tax money going for anything. I definitely know some of those people. But like I said, this, yes, increases your taxes, but you end up saving money in the long run if this is implemented correctly. Now back to New Hampshire. Schmidt argues that in New Hampshire, with more than twice Vermont's 624,000 population, which again was proposed in Vermont and did not pass because of the cost, they say that New Hampshire is better situated to take on single payer, and he pointed to a second LSR of his, which would create a commission to study a New England-wide single healthcare system to pool costs, an approach he called more viable. So he's looking into a study of how to implement single payer in a state. Now he says, so maybe some of my fellow Democrats will say, oh, well, that's too radical. We can't do this. We can't do that. And I say, why not? Because it works just fine for people over 65, those already on Medicare, and it works just fine in the rest of the world. And that, of course, makes sense because what he's doing is he's saying facts. It works great for people on Medicare. Go and ask them. Go and ask them if they'd rather get back on normal private insurance and give up Medicare. And go ask anybody who's in the system in Denmark. I got to tell you, I got to go back to this debate between Bernie Sanders and Ted Cruz. Now, there was a Dutch right-winger that was brought in to go and try to wreck Bernie Sanders. Oh, you want you want Denmark-style healthcare, but you don't want to pay for it. And kept going back to that guy, and it's like, actually, no, we actually have better healthcare, less waiting times, and actually is more efficient. Oops. The arguments that they use against single payer don't work. Even if you bring in somebody who's under a single payer system to try and destroy your opponents, people who are proposing single payer, they can't do it because it's obvious. It's that much obviously better than our system of multi-payer private for-profit insurance. Now, there is one country that actually does a multi-payer system and actually does fairly well. But in that system, and I believe it's Switzerland, yeah, they have insurance companies, but they're all nonprofit. And it still costs the government a lot of money because they end up subsidizing the premiums. But nonetheless, single payer, as I said, works. And our system does not work. That's why it needs to change. Now, Schmidt is getting a lot of pushback, of course, by Republicans and also a lot of Democrats. Now, for example, Lucy Weber, who is a Democrat, a local Democrat, said that while she supports the idea of single payer, we just can't get it done. Quote, I tend to look at what's in the art of the possible. With the current makeup of the House and the Senate, I think it's highly unlikely that we're going to get anywhere near a single payer system. And that, I think, is the establishment response. Well, we're not actually going to get it done, so let's not take it up, let's not vote for it, let's not do anything. Either that or the other response is, like I said, oh, we just can't pay for it, it's pie in the sky. What can you do? It's too expensive. We're going to have to raise taxes. Yeah, you're going to have to explain to people that taxes are effective and they're all right when it actually goes to something good. And by the way, in the end, you're going to end up saving more money because you won't have to deal with insurance companies anymore, which charge money for advertising fees. Because that's where part of your premium goes. Advertising, executive bonuses, and all this frivolous stuff that you actually don't have in a single payer system. The administration costs are actually far, far less under a single payer system than they are in a private system. But you see that argument over and over again. And unfortunately, there's a lot of people who don't make a proper counter argument to that. Now, we saw this in California. We see it in Colorado. We saw it in Vermont. The same arguments from the same kind of people who happen to, whenever the idea of single payer comes up, receive lots and lots of money from the health insurance industry, who would, of course, spend millions of dollars lobbying against single payer healthcare. And it's here where we see the unfortunate influence of money in politics in our local elections. But still, nonetheless, more and more states are starting to have this discussion. And maybe one of them, California maybe, will end up breaking through. And when it does, if it does, a lot of states, I think, will end up falling like dominoes. As soon as they realize that universal health care, single payer for all, is the most cheapest, the most efficient, and one of the best systems. There's a reason that most wealthy industrialized countries do it. And that's because it works. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.